Hello to all our viewers. My name is Mrs. Linda Mary Tediku, and I welcome you to Matters of Life. On this platform, we educate and create awareness. And we want to welcome you once again on our platform. Today, I have two guests with me. We have Mrs. Abigail Adabanka, and then we have Miss Ruth Asiedu. Or I would like you to introduce yourself first. We have they are both physiotherapists, and we want them to introduce themselves to us before we begin the program. So first of all, I'll go to Abigail to tell us what you do.
Thank you so much for having us. So like I said, my name is Abby Adabanka, and I'm an occupational therapist. I've been an occupational therapist for about 8 years now. So I've worked mainly in sort of hospitals in around Hereford and London. My most recent post before moving was working in trauma and orthopedics, so I was the Band 7 team lead there. And I've recently moved to the West Midlands, and I'm now working in community neuro.
Right.
So that's a bit about me.
Wonderful. Okay, we'll go to Ruth. Please, Asiedu.
Thank you, Mami. Hello again, everyone. My name is Ruth. I am a physiotherapist. I finished my degree about 3 months ago, so I'm a fresh physio. I don't have such history, but by God's grace, I'm working in a hospital.
Right.
I work in a stroke department, so we deal with like anything acute stroke. You've just had a stroke, you come in, we admit you, and then we do the first assessment in terms of physio, in terms of to make sure that you're well and your motor function and all of that stuff.
Wonderful, wonderful. So our topic today is chronic back pain, which many people suffer from it, from epidural and many other things. And so we thank for having you here. We are so grateful to have you in our midst today. And we thank you so much. So we want to begin with the questions. I want to ask, what is chronic back pain? Someone may not know. So if you tell us, what is chronic back pain?
Chronic back pain is the answer is literally in the name. Is back pain that is chronic. And what makes it chronic is that in the NHS we classify it as anything over than 3 months. So if you've had pain and it's lasts longer than 3 months, then it then becomes chronic.
Okay.
There's a lot of causes to it. It can be very simple causes. For example, maybe you don't sit properly all the time. You're always slouching in the couch, and there can also be other more serious causes like, for example, some neuro degenerative conditions that maybe symptoms of that. So there are a lot of causes. Also, just simple osteoarthritis that we have, like our normal joints. You can get that in the spine as well.
Right.
That can also cause you back pain. So there's a lot of different causes to back pain.
Wow.
Very, very.
And I believe we're going to learn.
Yeah.
Some of the difference, Thank you so much, Ruth. Yeah. So my next question is my back pain likely related to my posture, lifestyle, work or habits? Is there any posture? I think she has said what back pain is, but is it likely to relate my posture or in it?
It can be quite a lot of things. It could be your posture, so that could be at work, for example, if you're a healthcare assistant. How are you, moving and handling your patients? How are you using the hoist? How are you trying to get patients out of bed? Are you dragging them out of bed? Are you holding them by the shoulder? All of that stuff will impact on your back.
Right.
Even as simple as picking up a box from the floor after you've done a big shot. How are you picking those things up? So all of that stuff will have a huge impact on your lower back.
Right.
You could also have a more medical reason, so not so much of a muscular reason to why you have back pain. It could be that you've got a disc in your spine that's moved slightly, that's wearing off, there's got a bit of wear and tear. Could also be potentially an infection on your spine. That's also quite common, but that may cause also some back pain. It could be as simple as having had a car accident or some traumatic experience to why you've got back pain. You mentioned earlier about having an epidural. Some women experience that from back pain. Pregnancy is a huge thing as well as to why that causes back pain. Ligament alignments in your back can cause back pain. So it's being able to identify why you've got that pain.
Right.
Is it a muscular problem? So there's something wrong with your muscles. is it a spinal problem where there's something wrong in your spinal cord that's causing the back pain? Or is it as simple as just a bit of roughing and tugging, maybe you bumped against something? So it's really important to establish why you've got that pain and where it's coming from and how long it's lasting for. That will give you a clue as to how serious it is.
Okay.
So if you find that you're now losing, your bladder and bowels are becoming, like you've lost that sensation where you're having accidents, that's a big red flag, isn't it? There's something not quite right with your spine. If it's just as simple as I bend down and I've got a bit of pain, that might be more of a muscular problem. So it's different reasons to why people have back pain.
Right.
And another thing that I wanted to add is that back pain is incredibly common. Recent evidence shows that at least 70% of the population will experience back pain at some point in their life, and it's not. So it's a lot to do with like the kind of lifestyle that you live, and like if you think about it, your back carries you from like the moments that you're born, when you're standing, when you're sitting, when you're carrying babies through pregnancy. It's like your back is always with you. As you're pushing and pulling and going to shopping, your back is always with you. So lifestyle plays a very, very big factor as to why someone might develop chronic back pain.
Thank you. I believe as we go on, we find solution to and so definitely your GP can assess you and tell you what is causing the back pain, whether it's a muscular something or as you said. So you definitely have to go to your GP for them to assess you. Right.
And in terms of that, we were just speaking the other day, weren't we? That like me, for example, if I've got back pain, I go to my GP, I want an x-ray. I'll work in the NHS, I want an x-ray, I want what's going on. But that's not always the case. GPs won't always refer you to an x-ray. They will find out why you've got that pain, and almost triage you and kind of find some questions. If they think that actually a physiotherapist could help you with some exercises, they will refer you to that. People tend to assume that if I've got back pain, I'm going to get a scan and I'll get a solution. That's not always the case. GPs will only refer you to the hospital for further investigation if they're concerned that there's issues with bowels or bladder, which indicates there's more of a serious spinal cord problem. So that's when you'll get an MRI scan or CT scan or an X-ray.
All right. Okay. Thank you for that. Yeah. So my next question is: could an injury from my past be contributed to back pain now?
Yes, it's very common that an injury from the past, something like a little bump that you bumped into something, or a little accident, you start feeling some pain. It's very common. And also if you have like some sort of trauma to your spine and it doesn't heal properly, as the muscles and tissues are coming back together, if they don't come up properly and if it doesn't heal properly, it can also give you like some lasting pain as well. There's also something called pain memory. For example, I don't know if any of the audience have experienced that you've been to the GP, they said, it's all in your mind, it's all in your mind. It's not because they are discrediting what you're saying, but because psychologically you can go through pain that is actually like not present, but you can feel it. You could tell anyone, I'm feeling, I'm sure that I have this pain that I have, but most likely it's just psychological. And for example, me, I hurt myself, I hurt my leg, and 2 years down the line, I was still feeling, there was no trauma to my leg. It had healed, but because I remember the pain, sometimes I felt like it was still painful. So there's also psychological, a big psychological factor as well in the pain that you're experiencing. So it's about determining whether, is it trauma that hasn't healed, or is it healed and it's not properly, or is it just like me remembering the pain that I went through?
Right.
Also,
thank you.
Are you making it worse? Maybe you've got a little bit of pain and you're still working, you're working in a care home, you're not doing your moving and handling properly, the pain's going to get worse. And if you're not changing in the way that you're working, maybe being a taxi driver, being an Uber driver, you're sitting in that chair for hours upon hours, your lumbar spine has got no support, you're sitting very curved into your chair, it will cause a little bit of pain, maybe in June. Come December, it's worse. Because you've made it worse. You haven't adapted to the way that your posture or the way that you're working.
Right. Thank you so much for that. I think we are learning a lot here. Thank you. So let me go to my next question. Are there any specific activities or movements that might be worsening my condition?
Yeah, definitely. So moving and handling.
I think you have said a lot, you know.
Definitely. As simple as how you pick up a box.
Yeah.
Or how you pick up your child.
Yeah.
I've got a 2-year-old and I am quick to just go, oh, on my shoulder. When actually I know, in my working experience, I should be bent by the knee, have your back nice and straight.
We always fail to do that.
Exactly.
Always.
Get the load closer to your body, so you're distributing the weight. But we're quick to just go, quick box. You know, so it's no, definitely.
Yeah, that's very true. Yeah, and it's also important to listen to your body as well. I know that in our community, we like to just go. We are very productive. We're very productive and efficient. So sometimes, even when the pain is there, you don't even realize until like after you go to bed, it's like, my back. Yeah, but your back has been giving you little signals when you're picking up that child, when you're picking up that thing in a proper way, when you're like driving for 2 hours with no rest, you didn't stop and stretch a little bit. You're giving you little signals. So it's very, very important that you listen to your body and you know the body like, okay, this makes it better, this makes it worse. It's very important to also prevent further damage if there is any.
Okay, that's good. I think we have to do that because sometimes, as you said, even when we are sick, we are going to work.
True.
We have to find some time and rest our body. I intend to have this back pain, and sometimes, I have to lie on the pillow, or lie on the pillow for a long time before I can find, release myself from that pain. So sometimes rest is also important. I've been not even sleeping, but you can relax, and as you are saying. Yeah, and I believe we will learn more as we go on. It's very, very important. Thank you so much for that. Now we go to diagnosis and evaluation. And what diagnosis test do I need to identify the source of my pain, e.g., S3 and other things as you are? Yeah. So did you get a question? What diagnosis test do I need to identify the sources of the pain? The source of pain,
So in terms of diagnosis tests, there's actually a lot. The GP can do some, the physio can do some, and also the scans, as we mentioned earlier. And what, if you're referred to a physio, for example, for back pain, what a physio would do is that they will, first of all, look at your spine. Some people have a very curved spine. Some people, they have scoliosis, so they're a bit, like they're not in their midline as they should be. So they'll first of all look at you, then sometimes if you have obvious back problems, you can see like on your back there's something like poking out. It looks a bit, it's not very uniform, like your back, your spine is not very uniform. They'll look at all of that. Then they'll look at kind of your range of motion, so how you move, how does your spine move. So they'll ask you maybe to bend down or to go as far back as you can, to lie there, to raise up your legs. They're all movements that your spine should be able to do. And then if you do any of those movements and you find that, okay, this is painful, this is not painful, this is painful, that's when they can pinpoint where kind of the source of the pain could be coming from. Yeah. And also, apart from that, you also ask you to do like functional movements. We like doing like functional stuff because realistically, you need your back to be able to function for you, to be able to do things. So they'll ask you to pick this up, they'll put something on the floor, try and pick it up. How does it feel? Yeah, so they will do all of that sort of assessment. And then also they will assess your strength in your core as well, because we don't realize, but like we actually need this upper strength to even to sit here. If I didn't have core strength, I wouldn't be able to sit here. So they'll assess your strength. They'll ask you to maybe lie down on the plinth and like bring your buttocks up and see like whether your back muscles can handle that and whether it's painful with that. So those are the kind of tests, and with where you say, okay, this is painful, this is not painful, that we can pinpoint, okay, maybe it's muscular, maybe it's more likely to be bone. And then in terms of imaging, like x-rays, as we said before, it's not always guaranteed that you get an x-ray. So it's very important that actually you are very honest with the answers that you give to your GP or to your physiotherapist, because if you're not honest, they can easily misdiagnose you. Yeah, a lot of the diagnosis is also what you tell them. Okay, when I come back from work, it hurts this amount of time, or they'll ask you from 0 to 10, how much does it hurt? It's very important that you're honest with that, because with the amount of pain then increases the severity of what your diagnosis is likely to be.
Or maybe medication, then you might be taking more medication than what you're supposed to.
So when you go as well, they'll ask you like a lot of subjective questions, isn't it? Like a lot of questions. It's very important. It's all part of the diagnosis. So it's very important that we're also accurate.
Are true to yourself and to the doctors.
As much as possible with the information that we give.
Thank you.
If it's slightly worse, So they would have done that test initially. That will be the first kind of thing they do, because they can do that in a GP practice or in a clinic. If it's worse and you do need to have an X-ray scan, the things they'll look up for is, so basically in our spinal cord, we've got a little disc inside, and they're basically like shock absorbers. And if they see that there's some wear and tear on, where like both of the vertebrae are rubbing against each other, that's not great.
Right.
If they see maybe one of the vertebrae is cracked or it's come out of alignment slightly, sometimes they can see if there's some form of mass or infection on the spinal cord again. There's a condition called border-equina syndrome, which there's so many different ones, but these are the kind of tests that they'll be looking out for to see if there's something more serious going on. And I know we'll go about the treatment in a minute, but if it's that serious, then we are potentially looking at surgery.
Right. Wow, that's good. Yeah, thank you for that. I think half of this has been answered, but let me, could my back pain be related to any other underlying health conditions such as arthritis or spinal disorder?
Yes. Yeah. The thing about back pain is that it can be very innocent or very simple, like, oh, it's just your posture, just you sitting down for too long, so stand up and stretch. Or it can be very serious, like an infection or cancer. So there's it's a range of severity. Yeah. So it's very important that, again, we get the right diagnosis early, so that we can take into consideration.
Some of the things can even be degenerative, like something you've been born with.
Right.
Yes.
You know, you could have something like muscular dystrophy. You could have MS. That can cause a lot of back pain. It could be as simple as MND, where some of your muscles are wasting down. So it could be a genuine, bigger picture of a genuine, a disease that you have. And the early onset and the early symptoms are back pain. But then we're thinking, oh, I just hurt myself because I wasn't carrying a box properly. But actually, you've probably got a disease that's almost formulating itself. So it can be very serious if you're not getting these things checked out. And sometimes we need to be our own advocates, because a GP may say, oh, just go to the physio and do some exercises. You know your body better. If you know there's something not right, you have got the right to request for an X-ray, because some of these things that can't be found is an X-ray or blood tests. Or sometimes it's even good to get two different opinions, because it might be that you've got a genuine health condition that's creeping up, but nobody knows.
Wow. Well, if I can understand you correctly, you don't have to diagnose yourself, because I have done a C-shirt and I thought it's the epidural, but it can be something else. So it's always, good to go and check to know that it's caused. Oh, thank you. Thank you.
I've had patients who they're falling, they've been walking, they're fine, they're probably in their early 20s, they're falling over more, bit of back pain, bit of leg pain, and they've gone all of these years not really having investigated what's happened. Then they get to their maybe 30s, 40s to then have scans to find out MS. And the trouble is, because they've had MS for all of these years, they've had relapses, they haven't had the medication to try and stop the relapsing. So the MS has gotten worse, and it's gotten to a point where medication now isn't helping anymore. So sometimes it could be something more serious that's slowly creeping in. So you've got to almost fight your GPs a little bit after the investigation happens.
That is
MS is been multiple sclerosis. That's another sort of spinal cord.
Actually, I said it can be range of many things. So it's also always good to check. If you check and there's nothing there. You are free, but if you
taxes, go to your GP, pay for it, might as well.
That's it. Use it. Thank you so much for that. Let me go to my next question. How can I differentiate between muscular pain and nerve-related pain?
It's a very good question.
Pain is something that's very subjective, and people describe it in many different ways. So it can be very difficult to find out whether it's muscular or nerve-related. But some of the common patterns about muscular pain is that there's normally some sort of trauma. You've lifted something up, or you've had an accident, or something has happened, and you can pinpoint exactly. So I can say, here, this hurts, this muscle hurts. When I move it, when I use it, this muscle hurts. While nerve-related pain is more like an area. You can't pinpoint. It's like, oh, my arm. Where in your arm? I don't really know. Just my arm. Just around here. The location of the pain is not exact.
Right.
That's one of the main differences.
Okay.
Another difference is the fact that muscular pain can feel very like as a dull, like an ache. Well, nerve pain, people describe it as like, oh, I feel like something is like running a knife through me, or it's like it's very sharp. The type of pain is very sharp compared to like muscular pain.
Okay.
So those are the main common differences.
Yeah.
But yeah.
Sometimes with nerve pain, you can sometimes get sort of pins and needles.
Right. Okay.
A bit of like tingly.
Okay.
Sometimes a bit hot. So it feels like there's a bit of fire in you, like it's really warm inside.
Okay.
But even if I touch it, I can't feel the heat.
All right.
But I can still
You
feel
can feel,
something
within you.
And you find that sometimes with nerve pain, that paracetamol or even pain relief doesn't make it go away.
Right.
So let's say I've got a bit of a dull ache here. If I get some rub, that sort of hot,
The hospital,
rub, I give it a good massage. Perhaps it goes away for a few hours. But with the more serious neurological nerve pain, that brings me to go away.
Right.
And any paracetamol, any ibuprofen doesn't make it go away. That's when you know that something
It's chronic, something.
muscular.
Okay.
Muscular pain is very obvious. If you happen to have like a muscle rupture, you see it's swollen, it's red, it's much more obvious. But nerve pain, you don't really know what triggers it. Sometimes it comes, sometimes
inside,
it goes.
Thank you so much for that. Thank you. We are learning a lot. Okay, let me go to my next question. What are the risk factors that could be contributing to my chronic back pain? Risk factors. Yeah.
Some of the risks could be your environment. So, for example, work. If that's the job that you have, that is the job that you have. If you're a healthcare assistant in a hospital, it's easier said than done. Just go and change your job because that's what's paying your bills. So that can be a risk factor.
Okay.
Another risk factor is your weight. You don't like to talk about it in the community, but you eat too much oil, you eat too much fat. So your weight is going to be a big risk factor. The bigger you are, the more likely that your ligaments are not going to be happy because you're carrying a lot of weight on you. Your knees are not going to be happy, which is going to have an influence on your lower back, which is going to have an influence on your shoulders, etc. So weight, also a lack of vitamin D can also be a risk factor.
Okay.
You find that quite a lot of people sometimes who have a lot of vitamin D deficiency. You find that some people just have a lack of calcium in their diet. That's a risk factor.
Oh, that causes a back pain as well.
Because that can cause osteoarthritis or any other arthritis. So any sort of bone rubbing against bones. If your bones are not strong, that's going to increase that risk. Age, unfortunately, the older you are, the more likely you are at getting a lot of aches and pains and everywhere. All over your body. So you've got weights, age, your weights, your employment, your occupation, even as simple as your environment. If you're living on the top floor with no lifts, there's more of a risk that your body's going to ache after some time compared to someone that's living in a bungalow, for example.
Okay.
Even as simple as a couch. If you're sitting on a couch that's too low for you and you're really struggling to do a sit to stand transfer, that's also going to influence on your whole entire body. So it's big as pictures of your weights and as small as just changing your furniture. Anything else you've got to add to that?
No, really, you mentioned all the points that I wanted to touch.
Thank you so much. Thank you. We have a few questions here. Let's go to treatment options. So what are some of the best treatment options for managing chronic back pain?
So as a physiotherapist, I would say that I know this is very predictable, but I'll say that exercise is actually very good for you. As our sister was speaking, when she was talking, said that your back carries a lot of your weight. It's actually like 50%. Your knees carry like 80%, and like a lot of it is also your back. It's almost like 50% of your back as well. So it's very important that we exercise those like trunk muscles, these core muscles that help you to support your spine, so that there's not a lot of pressure going into your spine. Imagine if you have just the spine itself, there's a lot of pressure, but then if the muscles around your spine are very strengthened, you have a good amount of muscles, active muscles around it. It can help you to decrease that pressure you're putting on your spine and on your back. So exercise is the gold standard,
Right.
gold standard management
Okay.
for chronic back pain. Even when you go to all the national guidelines for health, before they start saving even medication or surgery, exercise, like, give it a good go. And as a community as well, that encourage ourselves to that. When a physio gives you some exercises, like, adherence is very important. Don't do it one day and go back to the physio and say, oh, it didn't work. Did you try for 2 weeks consistently? If he told you 3-4 times a day, did you do it 3-4 times a day properly before you say,
I know we have a problem for that.
And then just to add into that, just what sister said, that even just like your knee and like your patella, if I take away my skin and look at the sort of the physiology of my knee, there's a lot of muscle that's carrying that that bone. Now imagine if all of that muscle is weak and like butter. How is it going to absorb all of that shock and that movement that I'm doing? So it's so, if you visualize it, it's so important to strengthen that muscle.
Right.
The other thing also is weight. Big factor. So apart from exercise, losing some of the weight. The less weight you have on you, the easier it will also be for your body to just carry itself. From an occupational therapy perspective, it's looking at your social environment. Yeah, looking at, well, I've got this pain because of X, Y, and Z. How can I change that? Is my couch too low? It's been as simple as people are struggling off couches and constantly being in pain to stand up. And all I've had to do is put some blocks under the couch and raise it, so you don't have to put too much force into that standing transfer. Or being able to maybe look at rehousing. If living on that top floor is not helping for you, looking at your bed, is your mattress of good quality?
That's
is that
another
mattress
thing.
20 years old? No wonder your back hurts when you're going to sleep, because you're sleeping on a mattress that's like butter. Yeah. So looking at, well, what's your mattress like?
Wow.
How are you sleeping? Your sleeping position in your bed, your position in your chair. All of these environmental factors. If you make some form of change to them, I can assure you there will be some influence in how your posture is in your back pain. So it's looking at a bigger picture sometimes and not just the exercise.
Okay.
And I was just saying, if you need some support with that, go to your GP and ask for an occupational therapy assessment. They can come home to you and assess your home from top to bottom and give you some advice.
Okay. Thank you. Yeah. We have few one. Let's go on. I'm taking some because some of the question has been answered in a way. So let me go on this one. What are the pros and cons of surgeries of chronic back pains?
Okay. So in terms of pros and cons, the pros is that there's a good chance that you get better. It relieves you of the pain, which is the reason why you went to hospital anyway. So it relieves you of the pain. So in terms of it can then lead you to a better quality of life. You're not in pain all the time. Pain is associated with depression and having, those kind of dark thoughts, those kind of sad moments. So you're pain free. You're a lot better. You feel more active.
Okay.
Benefit you as well.
Right.
Yeah. In terms of the cons, there's actually a study that said that about 20 to 40% of pain surgery, they don't improve the pain. So imagine you're going through anesthesia, you're going through this big procedure just to not get better. There's a chance that it's not guaranteed that, okay, if you have surgery, straight away you're going to get better. So it's good to bear that in mind, that as a potential con. Also, as we know, surgery is a big thing. There's a risk of infection, bleeding, blood clots forming. Surgery is a big thing. We all know that surgery is a big thing. So that's a big con. And also recovering from surgery, that's also not from...
Another thing.
Yes. It takes weeks of you staying from school, from work, staying home. So you need to take all of that into consideration when it's not like, okay, you become pain free instantly and then you can go back to, it will take time, especially spine surgery. It will take time for you to recover. Yeah. So you need to bear that in mind as well.
Right. Yeah. We are learning a lot here. Yeah. Thank you for that. Let me go to my next one. Can injections or nerve blocks provide relief, and are they safe long term?
Yes, they can be beneficial. So things like nerve blocks, even as simple as like a TENS machine that's having some sort of electrical circulation can be quite beneficial and helpful.
Wow.
But as advice from your consultant, yes, they can be of benefit.
Wow.
Everything has a negative aspects to it, regardless. Even drinking water can have its negatives. But in a nutshell, yes, if you've had your investigation and your doctor advises for these kind of more like more serious kind of treatments, if the benefits outweigh the negatives, then yes, I would recommend them.
Okay.
And that will be as per your consultation.
Perfect. Good. Yeah. So let's go for back pain management and lifestyle adjustment. What lifestyle changing, exercise and the others can I make to help relieve my back pain?
Yes, absolutely. As simple as even just taking some vitamin D supplements can help. I think we've touched on a few already about changing your home environment, engage in exercises, walk to the shop rather than driving if you can. Walk is going to be better on your spine anyway because you're walking and then sitting in the car and being slouched out in your car chair. So 100%.
Yeah. Other things that I can think of as we're speaking, as you were saying, incorporating exercise as a daily part of of what we do, because as a community we're very good on I'm doing exercise because I want to change this, and then once it's finished, okay, that's it. You're back to resting. You're sitting down long hours.
Breaking those habits is going to have a long-term effect.
Yes. So I definitely recommend that. Another lifestyle change that we might not think of is like actually getting on top of your medication. If you've been put on any medication, even for any other condition, make sure that you stay on top of it. Make sure that you're not, one day you take it, one day you don't.
Stop.
Yes.
Very important.
The only thing we haven't added that I would stress on also is looking at your posture.
Okay.
Really, if you're not sure about your posture, again, try get an occupational therapy assessment. Speak to your occupational health department in your workplace. If you've got a desk job, well, the chair you're sitting on isn't suitable for you. How curved is that lumbar support? How much support you're getting in your lower back? Because the less support you're getting, the more it's going to cause pain. So that's a really big one. Look at your posture. If you need advice, speak to your GP for referral for a professional.
Good.
Yeah,
and I think my next question. Oh, sorry.
I think when we're talking about posture, I think we're talking about very much occupational. But as someone that has just finished being a student, those hours in the library will catch up to your mind very quickly. Very quickly. When you're in the library working, please, every 30 minutes or so, get up, do a few stretches, go for a walk outside and come back.
Okay.
Yeah.
Thank you so much. And my next question is, how can I modify my work environment to reduce back strain? How can I modify? I think you have said a few of them. I mean, you've mentioned a few of them. If
where you're working as well, speak to you because that's your manager. That's their responsibility.
That's
to
right.
make sure you're well. Because if you're not well, you're going off sick.
That's right.
And then they've lost an employer and they're losing out on money because they're still paying them.
That's it.
So if you're working in a care field, make sure you're up to date with your moving and handling training. If you don't know how to use a sliding sheet properly, learn how to do that properly.
That's right.
If you're working in an office, make sure that Oki Health knows about your back problems so they can provide you with an adequate, suitable chair. If you're working in an industrial area, sort of building factories or anything like that, again, speak to your employer. They need to make those provisions to make sure that you are safe. So it's being able to vocalize those things to your manager.
And in terms of working as well, making sure that we complete the training accurately. We do a lot of manual and handling techniques. Just take your time to take it in because it's there for a reason. If you want to last in the career that you're in, I mean, it's important that you take all of those things into consideration. As well. Yeah.
Thank you. Let me add this, and then we'll go to long-term outlook. What are the roles that stress or mental health play in a chronic back pain? Roles. What are the roles?
Okay, so stress and mental health has a big impact on pain perception. There's a lot of research about people that are stressed or people that have mental health condition, how they perceive pain. They perceive it like deeper. They perceive more pain than the average person who doesn't have any mental health conditions. So it's very important that we also look after our mental health. I don't know if anyone has been to the physio or GP before, but they say, I think you need some cognitive behavioral therapy, you need to speak to a psychologist. They're all there for a reason. There's a lot of research that actually supports that. So I'd encourage everyone that if that's the that's the treatment modality that's been recommended to you, that you actually stick to and that you take it as seriously as you would take medication, for example. Because as a community, we think, oh yeah, medication, I want the treatment there and there. I want the physiotherapist to touch me, to put his hands on me to see exactly where it is. But if they
pain is a mental state.
Yes. Yeah. So it's very important as well that we take also that psychological treatment as important as we do take the physical treatment as well.
Right. Okay. Yeah. Because of time, let's go to the next question. And okay, how long does chronic back pain typically last? And is it probably for it to go away completely? I mean, completely. Does it last for a long term, or can it go?
What you have. Unfortunately, it depends on what you have. If you've got a bit like what, from your perspective, I guess, more muscular MSK type pain, with the exercises, and if you follow them through and all the advice that your physio gives you, they can go away.
Right.
For perhaps some of your more neurological caused conditions, maybe yes, maybe not. We can't tell. It's one of those things where you have your treatment, you'll have follow-on physiotherapy after your treatment, you'll have occupational therapy to look at your home environment to make sure that everything at home will help with the treatment you've had. So it's one of those things. I can't say yes, I can't say no. The idea will be, because your therapist will work with you, that you will have forever cured health and that you will be better. But it's one of those things that you just wouldn't know. It's between your therapist and you, the patient.
Okay. Right. Let me go on to my next question, and maybe after we'll give you time to, if something, you need to add something, the one left, I think some of them has been answered, but let me, can chronic back pain lead to any long-term conditions? Complications. Right. Can it lead to any long-term complication?
Yes, it can. When you have chronic back pain, especially when you don't manage it, or when you have done nothing about it, it just keeps, painful and it keeps affecting your life, you can, as human beings, we tend to avoid pain. So if my back hurts, for example, I'll start walking in a way that, okay, if I walk this way, it's less painful. So you start being rigid in some places, having certain postures that are not normal, compensating, that's the word. And then that can also cause an adverse effect on those muscles as well that now you're using to avoid the pain in the first place.
No new problem.
Yes.
Right.
Yes. So it can lead to further complications. That's why it's very important that any symptom of back pain that you have, you just get it checked. I know that maybe getting GP appointment is nowadays a bit of a task, but would you rather waste maybe an hour, 2 hours of the time just getting a GP appointment and then being free after, or would you rather leaving it long and then having other complications that maybe you didn't have to have?
Definitely.
Yes.
Even as little pains can cause your disc to slide. It can cause your disc to completely collapse. It can cause them to become decompressed, and that can actually lead to paralysis. So it can be a series of them not being, having no feeling from your waist down. It can be as bad as not being able to then turn or twist or go to a certain position, which can then have all of those long-term effects. So yes, the answer. Right. Little problems can end up causing a whole bigger problems. Yeah. So get the little things checked out so you avoid the bigger problems in the future. Yeah.
Thank you. I think most of the question left has been answered in a way. So at this point, I want to give each of you maybe 1 minute, 2 minutes to tell us anything you want to tell us. If there's anything I did not ask, or if you want to address the public, the viewers, any advice you want to give before we finish the program, please.
Okay. I'll go. So what I'd like to say that chronic pain, if you're experiencing back pain, is very normal. We've learned that a lot of people have it. 70% of the population is a lot of people can have it. So it's a very normal thing, but get it checked. Get it checked because it can be also a sign of something very sinister very quickly. There's something called caudate corner syndrome that if you don't spot it early, it can lead to total paralysis. Obviously, that's the bad end of it. Yeah. But it's always good to know that it can be something serious. So have it checked out, and also when you are given any treatment, make sure that you stick to it. Right. Make sure that you stick to it. Whether it's medication, whether it's exercise, whether it's psychological treatment, make sure that you stick to it and till the very end, so that you can say that you've given it a good go before even considering surgery, because that's a big operation and you don't want to go that way. Yeah.
Okay. Thank you so much.
And what I'll add, especially from an OT perspective, is looking at your home environment. Don't suffer in silence, and don't suffer when you don't have to suffer. I think we forget that the council, or where we are living, you're paying council tax, you're paying all of these bills, you're paying your taxes, NI, and so on and so forth. The government has got grants, and the government has got money to support you. So if you find that where you're living is not helping your body, you're struggling up the stairs because of your knee, you're struggling because of your back, get an OT assessment. They can write you letters for rehousing, they can look at getting you a stair lift, they can look at doing an adaptation outside your property. So the grants and the money is there. It's just about being able to tweak and look at what you're suffering with so that the council can help you. And that's what an occupational therapist is for. So if you need that support, the grants are there. It's just a matter of having the assessment, them writing your recommendation, and you submitting your application, and hopefully someone can help you.
Thank you for that, for the fund that is there. You know, sometimes you may going through this, you may feel the pain, you go to your GP, and they are not doing anything about it, but you are feeling, how can you escalate it? As you are saying, the OP, how can, is it OT or something?
OT,
how can you, reach them? And,
so you can get an OT referral through your GP. If your GP is being a little bit difficult, sometimes they are, you can actually just go to the council website. So say Birmingham, type in Birmingham Council Occupational Therapy into Google, and a number will pop up. And that's all over the country. We always have NHS OTs, so I'm an NHS OT, but you also have social care occupational therapists. So you can actually find their own number on the internet and call them yourself and ask that you want an assessment. These are the issues that I'm having. Please come and see me. Because at the end of the day, our job is to prevent people going into hospital. Because the more people are in hospital, the more money the NHS is paying. So if I can try and get you a stair lift to stop your back from hurting, for you having surgery, I've saved the NHS a lot of money.
A lot of money.
So I'd rather do that little bit of paperwork, get you a stair lift, which is only £2,000, they're very cheap, than you spending 3-4 days or weeks in hospital, which will cost the NHS like £80,000. So that's what we need to think of, is that all of these options and opportunities and grants are there. It's just getting an OT to apply for it.
Thank you so much. We've learned, we have a lot of information today, which I know is going to help a lot of people, because as you said, 70% are having this back pain, and I don't know, probably somebody may ask to, ask something more, in case, somebody needs more explanation of that. I believe they will come to us, and then we can lead them to any of you to help them. I want to thank you, take this opportunity to thank you so much for honoring our invitation. You've been so blessed, and we've learned a lot. Myself, I've learned a lot, from this, and I want to thank you so much. I know where you are coming from is a bit far, and we appreciate your coming. Thank you, I know, and this is not going to be the end. We'll see you again on our program. Thank you so much. Thank you so much. Thank you. All right, viewers, this is how far we can bring our program. We want to thank you so much for watching. I know you are blessed by this program. If you are blessed, please share, comment, and also, share it for somebody to be also blessed by this program. We want to end our program here. We want to thank you so much. I want to take this opportunity to thank our sponsors. There are a few people who are sponsoring this program, and we don't take this lightly. We want to thank them so much for, allowing God to lead them to, support this program. We are so grateful to all our sponsors. We also want to thank our media team for the great work they are doing to support this program. God bless you so much, media team, and God bless everyone who is watching this program. We will end here, and we'll see you in our next episode. God bless you for watching. See you.